Conrad Robert Murray. The defendant, Dr. Murray, is present with his counsel, Mr. Chernoff, Mr. Flanagan, Mr. Gorgian, and Mr. Pena. The people by their counsel, Mr. Waldman and Ms. Brazil, all 12 jurors, and the 5 alternates are present. Good morning, everybody. Once again, thank you for your timely arrival. We're going to resume with testimony in this case. Mr. Waldman, Ms. Brazil, good morning. You may call your next witness.
Thank you, Your Honor.
You're welcome.
The people would call Dr. Alon Steinberg.
Please raise your right hand. Do you solemnly state that the testimony you may give in the cause now pending before this court shall be the truth, the whole truth, and nothing but the truth, so help you God?
Yes.
You may be seated.
Thank you.
Please state your name for the record. Spell your first and last names.
My name is Alon Steinberg. A-L-O-N is my first name. My last name is S-T-E-I-N-B-E-R-G.
Dr. Steinberg, good morning.
Good morning.
Let me provide you with some instructions, which I give to every witness in every case. The first is to please sit back and relax. The second is to speak loudly so everybody can hear you. The third, if you're called upon to provide a yes or no answer, please use those terms rather than slang which can be a little tricky. And the last is to wait until you hear an entire question before you even start to answer it. In our daily lives, many of us are used to speaking over each other because we think we know what the question calls for. But in a court, we need to wait and hear the whole question before there's an answer. Is all of that okay?
Yes, sir.
Thank you. Direct examination by the people. Mr. Waldron.
Thank you, Your Honor.
Thank you.
Good morning, Doctor.
Good morning.
Sir, Doctor, in what field do you practice medicine?
I'm a cardiologist.
And can you tell us what is a cardiologist?
A cardiologist is a doctor of the heart. After we graduate from college, we go to 4 years of medical school. We do 3 years of internal medicine residency, and then 3 years in what's called a cardiovascular fellowship. Cardio means heart, vascular means blood vessels. The number one disease we treat is really arteriosclerosis or plaque. Why? It's the number one killer in the U.S. of men and women. Why is that? Plaque can rupture, close an artery of the heart, cause an obstruction and a heart attack and death. So we work hard to work on prevention, diagnosis, and treatment. The heart has a structure, and we diagnose structural problems of the heart. The muscle of the heart, if it's weak or stiff, can cause congestive heart failure. There's valves in the heart. We diagnose if it's stiff or leaky. Oh, absolutely. Sure. The valves can be stiff or leaky. The heart is an electrical organ. It needs electricity in order to contract. So if we diagnose problems called arrhythmias, which just means any rhythm that's just not normal, we do a lot of diagnostic testing. We're good at reading EKGs. We do monitors. We do ultrasounds of the heart called echocardiograms. We do various types of stress tests. One of them is called a nuclear stress test, where we can see the flow going into the heart. We do CAT scans and MRIs of the heart. We do angiograms of the heart, where we actually put a catheter into people's hearts and look into arteries. Some cardiologists put stents in to open up people's arteries. Some cardiologists do pacemakers, ablations, which is a treatment to get rid of arrhythmias. Some cardiologists put defibrillators in, which are special pacemakers that can shock and resynchronize the heart. So we do a lot of different tests. We are not cardiothoracic surgeons. Those are doctors that actually surgeons that open up the chest and do bypass surgery and put new arteries and veins or replace or repair your valves.
Thank you, Doctor. And everything you've described then is focused on treatment, care, and maintenance of the heart.
Yes, sir. That's our
As a cardiologist, you're not an expert in sleep medicine?
Not at all.
As a cardiologist, you're not an expert in addiction medicine?
No.
As a cardiologist, you're not an expert in anesthesia or pharmacology?
No.
How long have you been a practicing cardiologist, Dr.
I've been
Steinberg?
practicing for 13 years.
And can you tell us a little bit about your educational background? Again, you've told us in general terms the schooling required of a cardiologist,
Sure.
but you personally, if you could tell us, please.
I went to University of Texas for undergrad and I studied a degree. And then I went to University of Texas in Galveston, Texas for 4 years. And then afterwards I did my internal medicine residency in Jackson Memorial Hospital at the University of Miami. That's the residency where you work about 80, 100 hours and work at different wards. And then I did my cardiovascular fellowship or my cardiology training at University of Florida in Jacksonville.
And what year did that conclude?
That concluded in 1998.
And what is, Doctor, what does it mean to be board certified?
Board certified means you completed a cardiology fellowship and then you took an extensive 2-day exam and you passed it. It's a test that goes over the basic knowledge, skills, judgment calls in cardiology, and it's a good comprehensive exam.
All right. Now, Dr. Steinberg, are you board certified?
I am.
Are you board certified in more than one area of cardiology?
Yes, I have interest in nuclear cardiology, which is the study of radiopharmaceuticals that we mark on the heart, and we can see perfusion or flow into the heart, and we usually combine that with stress testing. I'm board certified in that subspecialty of cardiology, as well as the CAT scans of the heart, which is just a fancy x-ray where we can actually look at the arteries of your heart with a CAT scan. I'm board certified in that.
So nuclear cardiology and the CAT scans?
Yes, sir.
You've reviewed the background and the CV of Dr. Conrad Murray?
Yes, I have.
Okay, and you're aware that he, on June 25th, 2009, he was not board certified?
He was not board certified, yes, sir.
Now, where do you currently work, Dr. Steinberg?
I work in Ventura. Can I make a comment about board certification?
Please.
At this one? I just wanted to say that 90% of cardiologists, the first time you take the exam, pass it. That doesn't mean it's an easy test. It means we work hard to test it, but 90% of cardiologists who take the board certification pass it.
Thank you. So your current employment is where?
I currently work in West Ventura County.
And what type of practice or hospital?
I'm in a 9-man private practice group in Ventura and Oxnard, California. We practice comprehensive cardiology. We practice interventional cardiology. We have electrophysiology. Again, we do cardiac CT, MRI, nuclear cardiology, the whole gambit.
And these 9 individuals that make up this practice, are they all cardiologists?
They're all cardiologists, yes, sir.
All board certified?
All board certified.
And do you also have certain privileges or positions at any hospitals in the area?
I'm currently the chief of the Division of Cardiology at Community Memorial Hospital in Ventura.
And as chief of cardiology, what are your responsibilities? What are your duties?
Well, there's quite a few. The first thing I do is really credentialing and reappointment. What that means is when a doctor applies to be a cardiologist at our hospital, I'm in charge of kind of looking at their credentials, seeing what they've done, seeing if they have the proper training, and what procedures they want to do. So let's say a cardiologist applies to put in stents. I make sure he was credentialed before or has the training, and I assign him a proctor or a supervisor to look over him, meaning in the first 5 or 6 procedures, there's going to be a cardiologist in the room with that doctor to make sure that he is competent. And then once he signs off of this doctor, the doctor will gain full privileges. Then every 2 years, we reappoint every doctor and recredential him just to make sure that everyone is practicing competent cardiology and within the standard of care. The other thing we do is quality, meaning we look at quality measures in the hospital. Did everyone with a heart attack get an aspirin? If you come in with a specific type of heart attack called a STEMI, which is a very acute heart attack, did we open up your artery of your heart within 90 minutes? If you have congestive heart failure, Did we check how strong your heart is, and did you get appropriate medicines? We look at these measures and try and improve them. The third thing we do is something called peer review. Peers are doctors of the same level, and we review each other's cases. Why do we do that? To make sure, again, that we're all competent and practicing within the standard of care. But also when we review each other's cases, we improve education, competency, and also we promote patient safety.
Thank you, Doctor. Dr. Steinberg, what is the California Medical Board?
The California Medical Board is a government agency that oversees doctors. They license us, they regulate us, and they discipline us.
And have you volunteered your services, or have you worked as an expert reviewer for the California Medical Board?
Yes, I do.
And what is an expert reviewer in regard to the California Medical Board?
When there is a dispute or concern about a physician, a cardiologist in my case, they ask for an independent review from an expert reviewer. So they ask me to review the case and tell them whether the doctor was within the standard of care.
And when you say the standard of care, what is that?
Yeah. The standard of care is a complicated definition. It's rules, actions, conditions that direct patient care and have been established by authority, custom, or general acceptance in a community, and is reflective of a skilled, diligent physician. You guys don't have to remember that. The most important thing you have to know about standard care is just what your ordinary doctor should do in the same situation.
And is there a kind of a review process or kind of a protocol through the California Medical Board as far as how you conduct the review and what type of conclusions to draw, either with no deviation or...
Right. There's basically three. One is no deviation, that the doctor was within the standard of care and he did fine. The second one is a simple, which is just a minor deviation or difference. And then the third one is extreme deviation, which is a severe or major deviation. That's more or less defined as someone who, it's something from a doctor with good skills should never do, and it could be borderline unethical. And it's just like ordering a basic test or not recognizing a basic symptom.
And extreme deviation as...
extreme, yeah.
Yes, extreme deviation as used in these reviews and as used by the California Medical Board, is it also defined as gross negligence?
Yes.
Now, did you conduct an expert review through the California Medical Board in regard to this case and the death of Michael Jackson?
Yes, I did.
And prior to this case involving the death of Michael Jackson, had you conducted any other expert reviews regarding any other cardiologists?
Yes, sir.
Approximately how many?
I would say approximately 8.
And in those approximately 8 prior reviews, were there reviews that you conducted where you found no deviation whatsoever?
Yes.
About
I would say about half. It's half, and then the other half is simple. This was the first time I ever had an extreme deviation.
In this case, regarding Michael Jackson?
Regarding Dr. Conrad Murray.
That's the first time you found an extreme deviation?
Yes, sir.
If we could make sure we're not speaking over each other, it'll help out all of us. Thank you.
I'm sorry, can I have some water?
Happy to. Would you want to wait till we give you the water, or are you able to resume?
No, I can resume. I just
We'll do that.
didn't realize I should have realized I was going to talk this much.
Now, as a cardiologist,